I am Debbie Coleman, and I will be presenting you with a general overview of spina bifida. I was introduced to spina bifida in April of 1989 during a routine ultrasound in the 4th month of my 3rd pregnancy. I had never heard of spina bifida before that time. During the next few months, we looked into what information there was available on spina bifida. We learned that spina bifida is the most frequently occurring birth defect that results in permanent disability. Spina bifida is a neural tube defect that affects the spinal column, leaving an opening and possibly a sac on the lower back. We needed to make sure our son had surgery within the first 2 days after he was born. The damage at birth could be aggravated by a normal vaginal birth, and he should be delivered by cesarean section. The defect occurs during the embryonic stage of development. The location along the spinal column of the defect will give some indication of the severity of the defect. Most patients with spina bifida have various problems with their bladder and bowels. The skin is also affected. Someone with spina bifida has longer healing times for skin type ear injuries and are more susceptible to skin issues. Reproduction can also be affected, but spina bifida is not a cause for sterility. The image shows an example of the defect, with the back being the left edge of each image. This shows the 3 different types of spina bifida: spina bifida occulta, meningocele, and myelomeningocele. With spina bifida occulta, most patients do not even know they have had it. It is the mildest form of spina bifida. Some minor symptoms can occur later in life. Meningocele will result in the need for the surgery to repair the cyst on the back, but will usually result in no or minor damage or disability. Myelomeningocele is the form most people that know someone with spina bifida can identify with. Almost all cases result in some form of paralysis, and most cases result in hydrocephalus, which is fluid on the brain that doesn't drain properly. Since there are no obvious signs that the fetus might have spina bifida, routine tests such as alpha-fetoprotein or ultrasounds are performed early in the 2nd trimester to look for signs of neural tube defects and some other defects. If the defect is identified, then the information can be provided to the parents on what is known and options available. Very little can be done until after birth. For treatment, a good group of specialists meeting with the patient in a joint clinic on a regular and reoccurring basis has shown the most effective treatment plan. The doctors will all have experience treating spina bifida patients and plan their treatment in conjunction with the other doctors and specialists. For example, the orthopedic doctor and the physical and occupational therapists can work up pre and post surgical plans together for a more comprehensive treatment. There is still no direct known cause to why spina bifida occurs. It has been known that women that increase their intake of folic acid during their childbearing years have a less likelihood of having a child with spina bifida. They need to take between 400 and 800 micrograms daily before becoming pregnant. So starting at the onset of puberty would be the best time to start. The advances in medical care for patients with spina bifida have improved the quality of life and extended the life expectancy of these patients. Hopefully, we can find what causes spina bifida in the near future and stop the occurrence of this birth defect. Until this happens, we hope the improvements in medical treatment will continue to make life more bearable for those individuals with spina bifida. My son is now almost 26 and doing quite well for someone with spina bifida. Due to great team of doctors and therapists over the years, he has had a good quality of life. He is paralyzed below the knees and has had 15 orthopedic surgeries over the years and 1 neurological surgery 2 days after he was born. He can walk with orthotics or braces and has some bladder and bowel issues, but is healthy otherwise. There will be more surgeries, but he should be able to live a good life.